Developmental milestones are significant skills that occur at various points in time of a child's development within 4 domains: physical, socio-emotional, language, and cognitive. Physical is the biological growth of the body, socio-emotional is the emotional interactional growth of the child, language is their speech, verbal and nonverbal development, and cognitive is the psychological development. There will be 4 different types of development that will be talked about in this video: physical, socio-emotional, language, and cognitive. From birth to 3 months, an infant begins to be more independent. They start to support their head and upper body when they are on their stomach. This is known as tummy time, which they also begin to stretch their legs out. At this month of life, infants are also developing their muscles in their hands, arms, and legs. They may begin to roll, open and close their hands, swipe and bat at hanging objects, or push down on their legs while standing. At 4 to 7 months, infants develop their 5 senses: hear, taste, sight, smell, and touch, and develop their fine and gross motor skills. Infants at this age have more muscle control and are more in control of their responses, opposed to immediate reactions from the earlier months. From 8 to 12 months, infants are now capable of controlling their neck muscles. This allows them to sit up on their own with some support. They are now able to get off their stomachs and begin crawling. They may fall back down on their stomachs and return back on their hands and knees to crawling position. As well, infants can remain seated and look around and use their motor skills by grasping objects around them with their fingers. For socio-emotional developmental milestones in infancy, infants from birth to 4 months are very codependent. They anticipate being lifted and picked up when desired in response to soothing gestures from the parent. They also react emotionally through nonverbal communication of smiling. Now, at 4 to 8 months, infants are now recognizing familiar faces such as their parents, loved ones, and pets in the house. They laugh spontaneously and can mimic others. As well, this is the stage where infants tend to have stranger anxiety issues, where they are more likely to become upset when held by someone they are not familiar with. Between 8 to 12 months, infants are now showing severe separation anxiety and shows apprehension to strangers. They now begin to regulate their emotions and are more in control and more evident of expressing how they feel. Language is one of the main key developmental milestones that all babies go through. Language is a key way of communication and learning. Researchers have found that language development begins before a child is even born. A fetus is able to identify speech and sound patterns of the mother's voice. So as you can tell, it starts very early in development. Children go through a number of different stages and milestones as their language enhances. They start from crying and cooing sounds to begin to make more complex sounds and eventually single words to multi-word sentences. Infants start off with crying sounds and fussing sounds. Then eventually, a few weeks of birth, they start cooing and babbling. Babbling, which is also known as the pre-linguistic stage. They begin to make vowel sounds, and they usually babble and start adding a consonant sound to their sound, such as mama, dada, baba. Eventually, at around 9 months to 12 months age, children will produce their first real word. They understand a lot more than they can speak. They comprehend language twice as fast as they are able to produce words. They start producing single words at this point, which is also known as hollow phase stage of language development. Next, we will watch a video all about language development.
The best thing any parent can do is talk to your child, with your child, read out loud to your child, and model correct language structures and speech patterns. Babies, before they talk, there are a lot of things that are going on that they're learning and they are understanding before they can make sounds or verbalize what they're understanding. Their first cooing starts by 2 months, 2 to 3 months old. By 6 months is when babies start making different sounds. Maybe the sounds with their lips often come first, the ma, 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 and pa, pa, p sounds. At the age of 6 to 9 months, babies should be making some sounds, starting to respond to their name. At 6 to 9 months, they may start to understand when you say it's time to eat and you're getting the high chair, getting them in the high chair, they're understanding those routine, familiar activities. That's when sign language is helpful often too, to start using sign language, because they are understanding and can see that gesture. Maybe for milk, it's very concrete.
The cognitive domain is an extensive area of development where various milestones occur psychologically and is exerted physically. From birth to 8 months, infants are becoming more aware of their surroundings by attentively looking at objects, causing them to be focused. They begin to investigate their hands and move their heads towards colors and changes in light. They also begin to be attracted to people's voices, especially their parents. They then anticipate being fed and may open their mouths when food is seen. Between 8 to 12 months, infants begin to copy or mimic verbal and nonverbal communication of their primary givers. They will begin to point and start to respond to simple instructions according to tone and diction, such as responding to their name when being called. They also begin to use their mouth as their way of understanding the environment around them. To conclude, all 3 domains of physical, socio-emotional, and cognitive, along with language, all work together to promote developmental milestones in infancy ranging from birth to 12 months. This is the end of our video.